Aortic stenosis is a heart condition that's increasingly common as we get older.
Most commonly when calcium builds up on the aortic valve and prevents it from opening as much as it should or closing as much as it should.
If left untouched,
the heart grows to compensate for that. Like any muscle, if it's working harder, it grows bigger, and that eventually can compromise the blood supply to the heart, which can cause heart failure.
The good news is that it's very treatable. The Shipley Cardiothoracic Center at Lee Health was the first program in the state and the second in the country to conduct the minimally invasive TAVR procedure more than a decade ago.
We usually go in through the groin using a catheter about the width of my pinky, and we snake it up again, up through the aorta across the aortic valve, where we deploy it carefully to open up the aortic valve.
Dr. David Cervantes says the procedure takes about an hour and a half. After a short hospital stay, patients can get back to their normal lives in about a week.
This is one of the most rewarding procedures that I do. People feel better the next day. When they wake up in the morning, I've had multiple patients say how great they feel and how much better they feel, and they never could imagine that they felt this way. And you know, with most open heart surgeries, they hurt, you know, from the surgery, having their chest opened, but with this procedure, people instantly feel better.
TAVR is considered curative. Speak with your doctor if you're experiencing chest pain, shortness of breath, or fatigue. For Lee Health, I'm Devin Turk.